Hi there, I'm Dr. Stephen Fallon. Welcome to this Facebook Live. I've decided to host a few Facebook Lives for all of you that are following Fallon Dental Seminars. This is intended mostly for dentists, this particular Facebook Live, because I'm going to share with you how to use the iPad Pro to improve communication with A, patients, and B, your ceramist or your lab. So let me just check that this is actually running. I'm just going to check on my other computer with my Facebook page, and it should be here. Yep, it's going, so that's cool. So what we're going to do today is share with you some tricks on the iPad Pro. So this is the new iPad Pro right here. I'm just going to angle this so you can see it okay. There we go. And so this is something that I really like. I like this iPad Pro because it's the newer one that doesn't have the home button. I really like the way it feels. I like the little stand, and I like this Apple Pencil. So the Apple Pencil is really handy for lab communication and for patient communication. So you can do almost like a little DSD drawing right on the patient's pictures. So I used my camera system to take these pictures during a records appointment. Here's the camera here. So this is the camera system that I use. We took the pictures during the records appointment, and now I'm going to show you how I would improve the smile design just with the iPad Pro and the pencil. Now for lab communication, I also use the pencil to kind of draw things that I'd like changed. So for example, this is the bisque bake of a case, and I was just drawing in some changes that I wanted to the case in the bisque baked stage. So now with this, what I'd like to do is we'd look at the smile design improvements that we'd like to make for this case, for this patient. And what we would like to do is we would like to improve the incisal edge position because she has a bit of a reverse smile. You can see here the bicuspids are longer than the centrals. And we'd like the centrals or the bicuspid, the first bicuspid built out a little bit because it's a little in from the second bicuspid. The first bicuspids look like they're going in and it's kind of narrowing the smile. So to change all of these things, what we're going to do is we're going to hit edit. Oh, before I do that, let me record this. I'm going to record this. So I have a recording of it in case you can't see this very well. So there we go. That should be recording. Yep, that's recording. So edit. What we want to do is we hit this circle here and we hit markup. With markup, I can now draw on the picture. So I can click here for pencil. It automatically defaults to this thicker one. I'd like to use the thinner one. I can click here for almost like a highlighter, here for a pencil. This is a pen over here. This is an eraser. And this allows me to change the colors. So we can go blue, black, whatever color we would like. I would like black, and I would like to increase the incisal edge position. So you can see here, we're going to lengthen these teeth. I don't like that. I'm going to erase it. It's hard to draw upright. I'd usually put it flat to draw, but for this demonstration purpose, I'm going to leave it upright. So I'd like to lengthen those teeth, yeah, probably about that much to be more in line with the bicuspids. So maybe about that much and about this much here. I don't really like that distal corner, so I'm going to redo it. So let's say we go there. That looks pretty good. So I don't mind that. Can go like this. Oh, don't like that. Hard to draw vertically. So here we can go like this. That looks a little better. Same with that. So that doesn't look bad. You know, these aren't perfect, but it gives me an idea of what length we want to change these to. I want to add some length here. And I would probably make these less straight. Whoop, don't like that. That looks a little too straight. There currently she has some older composite veneers, which aren't bad, but we can improve upon them. So I'm going to lengthen that. That looks decent. And then I'd like to give this, yeah, a little bit more curvature, probably like that. I'd like to give more cusp tip on the bicuspid, the cuspid, to match the bicuspids a little better and to improve the guidance. And then this bicuspid I'd like to build out a little bit, although it's hard to see in black there. This one I'd like to build out a little bit. And then the second bis are built out. So this gives us at least a starting point. They're a little square. So the other thing that I'd like to get from the patient, she came in with a pretty square old composite veneers. We'd like to get an idea, do you like them square? Or would you like your teeth more rounded? So we could go to a blue and change them a little bit with the blue. Do you like this black, or do you want to see maybe a little bit more rounding of the teeth, more like the blue here? And we could have even an interactive discussion, changing the tooth shape a little bit with the blue and the black lines to find the place where she would like them. And we could do all of this at the treatment planning consultation. It gives a more interactive approach to treatment planning, and it'll get the patient involved, get her vision of what she would like. And then we could also send this to the ceramist to complete the wax up. Now, let's say the centrals don't look long enough for the patient. Let's see how they look in red. We can make them a little bit longer. For some ladies, having longer centrals, more dominant centrals looks even better. Would we like them a little bit longer? That one I think looks a little too long. Now I've erased some of my black, but we'll go back. What would we like the length to be? So this is kind of a nice way to get some initial digital smile design that's really nice and interactive, easy to use. I can do a better job if I lie it down, I'll tell you, to draw. My drawing ability is much improved if I lie this thing down. I could definitely draw a lot better lying down than sitting vertically. So that's a little bit better. I'd probably close the embrasure a little more between the centrals. We could try slightly longer centrals. Yeah, that doesn't look bad. It's a starting point. So this just gives us an interactive starting point for the smile design for you and the patient. And then you could even add notes to this. So say the patient would like to say, whatever they'd like. You can add an arrow and add a note. Close, central, embrasure. And this all can now be sent to the ceramist as a really detailed image of where you'd like to go with the case with the wax up. So we can save this. You can see right here, save. And then you could go back and forth between the original and the finished. So this is where we started. You can see the reverse smile line, very square. Here's slightly more rounded, longer, fuller on the buccal corridor. And these are just some improvements we've done for this particular patient for her smile design. So that gives you an idea of using this Apple Pencil to help out with your smile design. I think that it's possible this could be something fun for you. I like using it, and it's very handy. If you'd like to see more case acceptance information from me, I have a full webinar about case acceptance. Let me show you that. It's right here. Master Your Case Acceptance. This is a new webinar with me, yours truly. and it will show you my system for case acceptance, which is really not anything to try and manipulate patients into making bad choices about their dentistry. It's really about being non-manipulative, ethical, and just helping patients make good choices that are customized and appropriate for them. So, there's no one way to treat any kind of patient, no one specific thing that you have to do for a patient. There's usually multiple options for most cases. So it's really a good way, this webinar teaches you a good way to communicate the different options to the patient that are available that you can talk about to help them, basically tell you what they'd like for their case. In a way that they can see the images of their mouth, and you could talk about where you want to go and get their vision really dialed in for where they would like you to take their treatment. So that's what this webinar is all about. So if you'd like to join this webinar, I've placed the link in this live stream. It's phelandentalseminars.com/MYCA-reg. So you can join this, and we'd be happy to tell you about our case acceptance system. It's worked really well for me. Again, it's just really about helping patients make good decisions about their dentistry. And it's a visual case acceptance system. It's really about showing a lot of images about what we can do for them and showing images of where they're at and their current situation. So it's not a lot about showing models of teeth. It's more about showing images. And this helps people really make good decisions. So I think that it's worked well for me. It's worked well for a lot of my members in my courses. And I think it could work well for you as a dentist to be able to communicate with your patients, because communication is the key. Because you don't want to get a misinterpretation of where the vision is for the case that you want to go. That patient that I just showed you, that smile design, I drew on that, but now we'd have the opportunity to go back and look at it together, her and I, and get a very clear indication of what she'd like. Maybe some of those rounded contours are too round for her. What she would like is more square but longer, because right now she has fairly square smile design. We like that square smile design just a little bit longer to create an improvement on the reverse smile that she has, the reverse curve to her smile. So we can draw away on that, and it's really handy. I could draw on my drawing, as I showed. So, you look at this is our initial smile design starting point. She could say, oh, well, I'd like this a little bit square. So I can go, okay, what is it that you have in mind? Are you thinking, let's go to red. Would you like this square here? And this square here? Is that more what you're thinking? And this square right here, and maybe right here. Like, who knows if that's what she would want? But this is a good opportunity to get an idea of that when you're going through the drawing process. So I don't know that she'd want that. I'm really not sure until we talk about it in detail. But this gives us the starting point for the diagnostic wax-up, having an image like this. And it's a simple DSD technique using new technology. This is the Apple Pencil. This is the new iPad. You can use the older iPad and the older Apple Pencil also. They work really well. But this new one's just the latest, greatest. I like the way this feels because it has a flat corner. It's like the old pencils we'd have in grade school. So there we go there. So yeah, if you'd like to join my webinar, go ahead. Click the link that I've added to this Facebook Live. If it's not there for some reason, I'll add it later in the comments below, or I'll add it in the comments below anyway. So if anybody has any questions about this, you can ask them here, or you can ask them in the comments below if you're watching the replay video, and I'll try to go in over the next few days and answer any comments or questions you might have. This was, as I said, mostly intended for dentists. However, if you're a potential patient and you'd like to know about what can be done to improve your smile design, and you're in the Greater Toronto area, or you're going to be in the Greater Toronto area and you want to come see us, just contact my dental practice. And if you need the contact info, you can leave a comment below here as well, because this is a great system to be able to see the potential of where your smile can go. So that's about it. I don't see any comments yet because it's kind of the middle of the day, and perhaps you know, we don't have that many people when I do an unannounced Facebook Live like this joining us. So you can watch the video replay and ask any comments or questions below this video. So thank you very much, and we'll talk to you soon. Take care. Thank you.